Good afternoon, and thank you for joining us. My name is Rich Sheehan. I'm the Director of Marketing and Public Relations for Boulder Community Health. BCH is a couple weeks away from launching an important new behavioral health service, a partial hospitalization program, also called a PHP. Over the next 20 minutes or so, we're going to provide an overview of what partial hospitalization is, how it fits into the continuum of behavioral health services, and describe the unique nature-based approach that BCH is taking with our program, which we're calling Pathways PHP. Our speakers are Dr. Wesley Tate, the Director of Pathways PHP, and Ema Beilke, the Program Coordinator for Pathways. Dr. Tate is a board-certified psychiatrist who specializes in nature-based care and focuses on people's connection to nature as a source of healing. He takes a holistic approach that emphasizes improving quality of life for those living with mental illness. Ema Beilke is a licensed clinical social worker devoted to supporting people in their growth and healing through connections with nature. Her career began as a participant in a nature-based therapeutic leadership program. If you have questions during the presentation, please send them through the Q&A at the bottom of your screen. We'll answer all your questions after we complete our presentation. I'm now going to turn the microphone over to Dr. Tate, who will explain why BCH is starting this important new service. Next slide.
Thank you, Richard. On behalf of Emma and myself, I want to say how excited we are to be here to introduce the new Pathways Partial Hospitalization Program to the BCH community. Thank you all for taking the time to join us today. I'd like to start by sharing a little bit about my background and training and where the idea for a nature-based intensive group therapy program came from. I did my general psychiatry residency at the University of Arizona in Tucson, starting in 2002. At that time, Andrew Weil was just starting his integrative medicine fellowship. There weren't many people at that time talking about a holistic integrative approach within a traditional healthcare system. Faculty from Dr. Weil's program offered seminars for the psychiatry residents. Those interactions had a big influence on my thinking about what constitutes mental health. Dr. Weil's approach emphasized that health is not merely the absence of disease. A core principle of my philosophy of care is that treating symptoms is not enough to achieve wellness. Wellness has its own specific factors, including meaning and purpose in life, and things that promote a patient's overall sense of social health, as well as physical and mental wellness. My goal in practice has always been to help patients develop their own capacity to live meaningful and fulfilling lives. During residency, I was lucky to train at Sierra Tucson, a long-term residential facility in the Catalina foothills near Tucson. Clients would spend several months doing group therapy, often outdoors in a beautiful resort-like setting. I spent my last year of residency as chief resident at Sierra Tucson and worked with clients in both the dual diagnosis program and the trauma program. Working with folks in addiction and trauma recovery made me realize how important social connections are to recovery. It was often the positive peer support clients received that created opportunities for real transformative change. Sierra Tucson also taught me that nature often facilitates healing in ways that no other treatment can. I'd always known that time spent in nature was important to my own mental and physical wellness. In fact, it was the time I spent in Sabino Canyon and in the Catalinas that helped me survive residency. But I didn't appreciate that time outdoors and experiences in the natural world could be a therapeutic treatment in and of themselves. The residential program at Sierra Tucson helped me see how nature-based care could be an effective type of treatment for people with mental health problems. So fast forward to 2017, the year that I first started working as a staff psychiatrist at BCH. I was also volunteering as a research advisor for Thorn Nature Experience. Thorn had partnered with the City of Lafayette and BBSD, the Boulder Valley School District on a program called Nature Kids, which was designed to increase access to green space and implement an environmental education curriculum in K through 12 grades in order to help build a healthier community. The program was piloted in 5 BVSD schools in Lafayette, which is where I had my outpatient practice at the time. Nature Kids received a $2.5 million grant from GOCO, Great Outdoors Colorado, for this project as part of their Inspire initiative. During the community engagement process, the program's evaluation team started hearing from families in the community that mental health was a bigger priority for them and their kids than physical health. This came as a big surprise to the program coordinators who had submitted the grant application to Inspire, measuring physical health outcomes in terms of obesity and heart rate and physical activity as something that being outdoors could help improve, and had partnered with Kaiser's Institute for Health Outcomes to measure that. But mental health parameters were not something that had been factored into the grant application. They asked me to help them develop some mental health outcome measures for the program. As a result of the project, I got connected to doctors and healthcare providers in other communities who were trying to promote the health benefiting effects of nature. Several of these providers were involved in starting the Park Prescription Program, which encourages healthcare providers to write prescriptions for patients to spend time in nearby natural areas such as public parks. This program has since grown in the last decade or more into a nationwide program that is still community-based and oftentimes initiated by individual providers, often primary care providers and pediatricians in local communities around the country. The National Park Service started a program in 2011 called Healthy Parks, Healthy People, which is the cornerstone of their project to reimagine the role of public land in service of human health and wellness. For the past 4 years, I've worked with awesome support from folks at BCH on developing a program that would combine what I learned during my residency training at the University of Arizona, what I learned from my experience connecting kids and families in Lafayette with access to green space, and what I learned from my exposure to the research literature that supports projects like Healthy Parks, Healthy People, and the Park Prescription Program. The result is the mindfulness-based intensive nature group therapy program we are here to talk about today, the Pathways PHP. Next slide. The Pathways PHP program is built around 6 core principles. These principles reflect my experience and training that I've just reviewed with you, but I want to go into a little bit more detail about what those core principles are so you can see how they affect patient care and who might benefit from being in the program, something that Emma is going to talk about in just a little while. The primary principle is nature-based care. It is, again, my own personal experience and many people who live in Colorado's personal experience of the transformative power of being in nature, whether that's for mindfulness-based stress reduction, whether we call it that, but we know that when we're out in nature that our heart rate slows, that our mind is more focused, that we're more attentive, that we have greater control over our attention, that we're oftentimes more creative. And all of these findings are not just based on personal anecdotal evidence. They're supported by what is now a very rich and robust literature. The Children in Nature Network, which I was fortunate to partner with for a brief period of time, has a literature library of over 600 peer-reviewed journal articles, many of them randomized controlled trials supporting the health promoting benefits of spending time in nature. The other key component of the program is group therapy. It is what I learned from my experience at Sierra Tucson, which is that it is oftentimes the positive support that clients receive from peers that has the most transformative impact on their well-being. Next slide. 2 other important features of the program are that it provides patient-centered care. And by this, we live in the era of personalized medicine where a lot of that has to do with genetic genetic testing and targeted interventions. But what I mean by it is that patients are treated in a holistic manner in which their social health is taken into account, and that activities and programs and aftercare is targeted to help them more successfully integrate into their communities in order to overcome what is becoming an epidemic of loneliness and social isolation in this country, which we know is having major impact on people's, not only their mental health, but their physical health as well. And I think if the pandemic, the COVID-19 pandemic has taught us anything, it is the dangerous impact of socially isolating people and keeping people away from the community and social supports that are necessary for all of us to feel that we have meaning and purpose and are leading fulfilling lives. The program will be run by a medical director, myself, who will provide psychiatric care to patients, including psychiatric evaluations and weekly medication management when appropriate. Next slide. The last two pieces of our core principles include social prescribing, which is a term that is not quite as widespread here in the US as it is in Europe. It's a big feature of the National Health Service in England's agenda for the coming century, which is the idea that we've been discussing and that I've said has really informed my philosophy of care, which is that people's social health is integral to their mental and physical well-being. And that if you want to have a large influence on physical and mental health outcomes, one of the areas that's ripe for targeting is this area of social health. How can we get people more connected with each other and with organizations and activities in their community that can lead them to have not only overcome a sense of isolation and loneliness, but to help them feel that they have meaning and purpose in their lives. And so social prescribing is a big part of that. And what some people call green prescribing, which is social prescribing with nature in mind, is a component of social prescribing as well. And then the last principle that I want to talk about today is trauma-informed care. This is prevalent throughout mental health system as more people within behavioral health come to recognize the lifelong damaging effects of trauma. Catastrophic trauma at any age has significant effects, and we know that because it's embedded in the DSM diagnosis of PTSD. But we're now learning that things like complex trauma, early developmental trauma, not only abuse, but neglect and emotional abuse can cause scars on people's mental health that last a lifetime. And oftentimes patients that we see that have treatment-resistant depression and anxiety, things that we think are treatment-resistant because they're not responding to medications, is often because there's an overlooked or inadequately treated aspect of complex trauma involved in that. And there's good evidence to suggest that positive experiences in nature can have a healing effect on people that are in recovery from trauma. So that's just a brief overview. I hope that that gives you all some sense of what our core principles are, motivated by the philosophy of care that has really influenced my work, clinical work, over the last 15 plus years. And so I'd like now to turn it over to Emma, our program coordinator, who can tell you a little bit more about the nuts and bolts of the program.
Thanks. Thank you, everybody, for being here. Thank you, Dr. Tate and Rich, and just for this opportunity. This is something that is powerful to me. I grew up in a program, and it helped me to influence of why I wanted to become a social worker. So I'm happy to be here, and I am excited that this component of BCH is going live. So all of you guys are wondering, how does this PHP level of care, of treatment, fit into our continuum? So it is like a middle level of servicing. We are prepared to serve those who are impaired in their functioning and where they need more clinical and more intensive treatment. PHP is kind of like the middle child. We serve those who have an impairment in their functioning and who need a higher level of care than just normal weekly visits in the outpatient setting, but who are still able to maintain their safety and not impaired to the point that they need to inpatient hospitalization. Next slide, please. To meet intake criteria for PHP, the client must be willing and motivated to seek voluntary treatment. For insurances to pay, they must have a primary mental health diagnosis. We are accepting people with dual diagnoses, but we cannot let people go through detox in our PHP program. On this slide, you will see various diagnoses that we accept. And in addition, for a client to meet PHP level of care, they must have impairment in psychosocial functioning due to a mental health condition, be experiencing deterioration in their mental health condition, or have been experiencing lack of progress in the outpatient setting, or having an exacerbation of their mental health systems if they aren't addressed in an intensive program. A lot of ways of thinking about it is we want to be a prevention for getting people, for people who may end up in the inpatient setting, and provide them intensive support and increase their skills and well-being and their functioning in their overall lives. Next slide. So logistical thinking is the core program is going to be a 10-day program over a span of 2 weeks. Our goal is to accept clients when they're wanting help and when they're motivated for treatment. So we are going to be accepting people on a rolling admission. The program is starting as a virtual PHP. The hours are going to be from 9 to 1. And then as we move forward into in-person programming, the times will vary as well. We are only able to serve an adult population at this time, but we are really excited once we kind of get things moving and more in person. Next slide. We have been set up so that we are able to accept most major insurance plans, including Medicaid and Medicare. And we also have a self-pay option where we can really support people who are motivated to engage in our treatment and do what we can to creatively figure out how they can have access to services. Next slide. We have created the referral process, so that's very easy for you. Most of the people here, I'm assuming, are part of the BCH community. So what you have to do in order to refer one of your clients to us is set a referral in Epic for an ambulatory referral to Pathways PHP. Or you can give us a call and we can step you through that process or talk about eligibility if necessary. Next slide. The very most exciting part is that I know this program has been talked about for a really long time, but we're going live with a scheduling go live next week, starting June 28th. All next week, we will be doing intakes and talking with people about the program and getting more information out. And then with hopes of the program beginning the following Monday, or I guess the following Tuesday on July 6th to start seeing patients. Next slide. So that is the nuts and bolts of what we have in our PHP program. We have plenty of time and we're going to stick around for questions and so we can answer those. I see here in the chat that there are a few questions already, but if you have other questions, please put them in the Q&A section and we will address them. So some of the first question that I have is, we will send a recording. Yes, we will send a recording of this presentation so that you can share it with your team. And there also, you can send questions to our email, which is pathwaysphp@bch.org. One of the questions from Amanda is from Pillar Program is there a cap on how many Medicaid clients can participate at one time? I'm going to say no, but Dr. Tate, correct me if I'm wrong. Is there a cap on how many clients for Medicaid we can accept at one time?
I'm not aware of any, no.
She said yay. I don't see any other questions now, but we'll just hang around for a few minutes in case a few other questions come in. One says, how many clients will be in each group? Right now, the program is designed that we don't necessarily have a cap in the virtual program. Ideally, I think the number that we're hopeful for is about 10 participants at a time. But we have flexibility in we don't have an exact number right now as capped. When we're in person, there will definitely be a number due to ratios and whatnot, but for now, our goal is to have at least 10 participants at a time. Dr. Tate, there's a question directed at you.
Okay.
Can you describe some of the activities that participants will do in the group program?
Yeah, I mean, Ema and I can both describe those, but I'm happy to go. So the program is built around a mindfulness-based nature therapy program that's developed by some of the folks from the Nature Therapist, American Association of Nature Therapy. And so many of the activities have to do, many of them are mindfulness-based. So they have to do with being present in nature, but also using activities that focus on ways in which nature has relevance for people's lives. Some of that's, people have a lot of symbolic associations with nature. We oftentimes use language around nature to describe human characteristics or personalities. We anthropomorphize nature a lot, and sometimes that has good clinical usefulness because we oftentimes draw inspiration from that, and that's something for many people that's aspirational, something that they positive traits that they see or ascribe to nature that can be motivating and can be personally sustaining for people. Obviously, there are negative sides to that as well. And so we want to try to build on some of those positive associations and help people that may not have those already or be as familiar with experiences in nature to draw from in terms of strength and resilience and fortitude, those kinds of characteristics that generally have positive connotations for people. There may be some people that don't have a lot of experience in nature and may not have those associations ready to hand. So a lot of the group experiences will be around developing those, but also doing those in collaboration with other people so that there's a social aspect of the group participating in activities together in nature. And then there are a lot of just mindfulness-based programming, everything from breath work to movement exercises to guided meditations and other sort of very traditional mindfulness-based exercises. Some of those things will happen outdoors, and some of those things will happen sort of nearby outdoors. So a lot of the program is really not focused on sort of traditional wilderness or adventure therapy ideas where you would take people necessarily out into far away nature, but it really is sort of using things that are close at hand and here immediately available to us here in Boulder. Some of those things are more geared towards the in-person programming where we'll actually be able to take people out into nature. The virtual programming is set up to use activities that people can be guided through, that they can do in nearby nature to wherever that they live. So there's a lot of structure built into the virtual programming that through videos and through community collaborators who've given us programming and exercises that they do, everything from field work that people do to spiritual care or other healthy practices that people have engaged in that have been really central to their mental health and wellness, especially during this pandemic time, that we want to be able to share with our clients. So a big part of the program is practice-based. So it's giving people examples of practices and rituals that community providers and community collaborators and our own staff find integral to their own health and healing practices that we want to be able to share, because it's really not about didactic learning as much as it is about experiential and hands-on learning. And so we really want to be in the role of transmitting practices and rituals that can really inform people's daily lives, and that we know from day one in the program that they're adopting new practices and we're not waiting to see them access or implement skills or tools that aren't relevant for them.
Well said, Dr. Tate. There are definitely a few other questions coming in. One of them from Amanda is also going over how to refer people again. So you can place a referral for, it's an ambulatory referral for Pathways PHP through Epic, or you can give us a call. We also have an email that we're available at, which is pathwaysphp@bch.org. But there are going to be tons of flyers posted throughout and also sent through social media and email messaging that will have all the contact information as well. Especially as we go live, you'll definitely be seeing a lot more of about this program. This is kind of one of our first big launches. Another question is, what type of personality is the best match for PHP? Dr. Tate, would you like to take that one?
That's a good question. So it's too bad it's not as interactive where you can't really get feedback quickly. If you want to put some more comments in the Q&A section about sort of what you mean by personalities, because I don't know in that case if you just mean sort of general like traits, what kind of person would really be motivated or interested in doing this, or if you mean like personalities in terms of sort of like DSM, personality disorders. And so I always just want to clarify that when I'm talking to a behavioral health audience. So I think we're going to get a broad range of people. I think we're going to get some people who are totally gung-ho about this because they're like, man, I know that like Chautauqua is my like go-to safe haven, or it's my healing space, or getting up to Rocky Mountain National Park, or just going to my local public park here in Boulder. I know that spending time in nature helps me because I go take my lunch break, out in the green space around the Foothills campus. I think we're going to get a range of people who have a range of experiences in nature. Everything from I enjoy sitting under a tree and just sitting quietly, and it helps clear my head from the chatter of the day, to people who are like, I need to get home and go for a run in the foothills, and that's my way of decompressing. And so we're going to have people who have some familiarity already with the sort of physiological benefits, and even possibly some of the mental health benefits of being out in nature. But I think we're also going to get people who are just willing to try something new, who have been maybe doing sort of traditional therapy in a room with a therapist, or maybe have done even IOPs or PHP programs that are not outdoor based. They may be mindfulness based. And so they may have some level of comfort already with mindfulness tools. So those things will seem comfortable to them. And it may be sort of just putting those into a new context. And I think we'll get people who have been through the system a lot. So they may be people with treatment resistant conditions that have been hospitalized because they're because they fail at sort of lower levels of care, or the perception is that they're not benefiting from lower levels of care. And they may come to us as a step down from an inpatient unit. That's a pretty common referral pathway for PHPs in general. But I really want this PHP to reach to people who may not think of themselves as someone who need to be in intensive therapy, right? Or intensive group therapy, or just may not think of themselves as someone who need to step up from outpatient care, right? They may be people who think, I'm getting by just fine. I don't really need, I don't need to, there aren't any particular skills I'm looking at learning. There's not really anything that someone in the mental health profession can offer me. This is really an opportunity to say, no, but wait, have you thought about, are you leading the quality of life that you want to have? Are there areas in which you'd like to see improvement? Are there ways in which you'd like to increase your social connections? that you want to feel more a part of a bigger sense of community, something outside just yourself? Do you feel that you oftentimes lack a sense of gratitude for what, you don't think your life is that great or that meaningful because of bad life experiences or negative interactions that you've had, maybe even negative interactions that you've had in the behavioral health system? And this is really an opportunity to say, look, this is a short, it may seem long to some people, but it's a very compact, very intense form of treatment over 10 days. Give us 4 to 5 hours a day. And at the end of those 2 weeks, see if you don't have a different take on whatever the thing was that you thought was holding you back. Whatever the barrier or obstacle is in your life that you're looking to overcome, give this a try, because it won't be like other forms of traditional therapy you've done. It definitely won't be like being admitted to an inpatient unit. It won't be heavy on medication adjustment. It won't be heavy focus on individual symptoms. It really is going to be about the whole person approach to, are you on the right path? Are you on the journey that you want to be on to get where you want to go? And this really is a program that allows people sufficient time to pause and reflect on their life and what's important to them, what values they hold, what's meaningful to them, and what drives them. What's their sense of purpose? What are they aspiring to? And so it's going to be a nice blend of some very traditional things, like there will be med management when needed. There will be mindfulness-based exercises and skills, but there will be hopefully a broader context in which all of those things sit, so that people from different backgrounds, different life experiences, different mental health issues can see something that speaks to them in that type of programming.
Awesome. Thanks, Dr. Tate. One of the questions from Catherine Messman is, can you remind us of the commitment levels for patients, length of treatment, and does the schedule accommodate working professionals? So I will speak to some of that. The schedule it's a 10-day program, and it's scheduled now from like 9 to 1 p.m. It's hard with working professionals because if they can't take that time off during the day, they would have to use something like FMLA or something. Or if they're able to adjust their schedule and work later in the afternoons. It is definitely a time commitment, like Dr. Tate said, but the goal is to have that intensive programming to hopefully help people readjust so they can even prevent more further impairment in their functioning. As for the commitment level for patients, I mean, they have to commit to those coming. I mean, it is a voluntary program. Nobody's forced to do it. Obviously, we want people to complete the whole program, but if people can only make it for a week, then that's gonna be what they make it for a week, and hopefully that even just that week will help support them create some changes in their lives. I hope that answered your question there. There's another question saying, can you give an example of a nature-based activity that will be used in the program? One of them is going to be doing some mindfulness walking in the community once we are, I guess, in person. Some nature-based activities that we're going to be virtual is we are partnering with various community members and other therapists to develop activities for people to do. So we're gonna set up the parameters for them and then help or invite them to engage in an outdoor activity so that it is in nature, whether it's in their backyard or if they are close to, if they have access to an open space in the open space. It will be some type like that. There's also very different ecotherapy, like art therapy activities that will be using different elements of nature as well. But we're definitely getting very creative in the programming that we're doing. Is there any other things you want to add about that, Dr. Tate? Any other nature-based? I know you kind of answered it a little bit earlier too.
No, I think that's true. I mean, so we're getting a lot of, and for this early part of the program, for the virtual component, we're getting a lot of video submissions from community providers, including some park rangers. and some yoga instructors and some people who people from Sharna's spiritual care program are submitting videos for us. So I think it's going to be a broad range of things, and like you said, there's going to be some ecotherapy art, some things around creating personal rituals, as well as doing some immersive experiences with guided reflections on nature, imaginative exercises, and what you said, like the guided walks will be a piece of that as well. So it is, as you mentioned, a blend of some traditional sort of mindfulness-based things with some nature-based components, as well as some sort of more ecotherapy type of exercises.
Awesome. Well, it looks like there are no more questions, so I think this might be a good stopping point for us. Please email us if any other questions come up at pathwaysphp@bch.org. Again, thank you for giving us your time and attention, and we hope that you have a wonderful afternoon, and feel free to call or email us if you want to ask questions or see if a client would be appropriate for our program.